Hello, this is Christian Dye from Latitude West Financial. This is Dental Careers Outside of BC, and today I've got Dr. Mike Ma, a UBC dental grad from 2015, who is now also an owner of a dental clinic out in Saskatchewan. So, Dr. Mike, thank you for being here.
Thanks for having me, Christian.
Yeah, no problem. And for our guests over here who are logged in, you can use the chat room to ask your questions. I will be quarterbacking all of that. And why don't we just jump right into it over here, okay? So, Dr. Mike, we'll be talking about success in your first year of practice, practicing outside of BC, and buying a practice as a young dentist over here. So, as we start over here, one of the first things that we look at is success in your first year. So loans, lifestyles, priorities, and the 5-year plan. You can start wherever you want.
Sure. Yeah, I mean, just to start off, Christian, I mean, at UBC and stuff like that, it feels like it was just yesterday that I was there. So I understand a lot of these questions are super pertinent, and you want someone who's only a few years out to give you guys an understanding of really how to best prepare yourself out for reality because I'm really excited for all of you to graduate because the struggle is actually worth it. And I everyone's struggle is pretty difficult, but for whatever reason, mine was pretty tough in dental school. And for me to say at the end of it all that it was worth it says a lot about how great the profession is. So you guys made a great choice. There's a lot of great things to look forward to, and hopefully I can help make the path a little bit more clear for you. So I'll kind of stick to the bullet points here, but loans, obviously there is a high debt load for a lot of students coming out of dental school. Your primary goal coming out of school is going to be debt reduction. Um, there is some things that should be talked about also, dedicating some sort of savings every month towards also building some sort of portfolio as well. And I'm sure Christian can talk a little bit about that, but I do agree that students should budget for that, and that's kind of what I typically tended to do. But like most students, I was focused primarily on debt reduction in terms of cash flow and where that and allocating that towards paying off my loans.
Uh,
I'm not really
can I ask a question here, Mike?
sure. Yeah, of course.
Tell me, approximately what percentage of your income did you put towards the loans, and how long did it take you to pay it off?
Um, I would say probably a good. I like in life in general, I kind of like to use the 80-85-15 rule. I kind of find that things tend to coincide really well with that ratio. So yeah, it was at least 80% of my income after expenses dedicating towards debt reduction, and I would say 20% dedicated towards savings or investment and future planning and growth and that kind of thing.
Oh, okay. So we're talking about sort of after your expenses were paid, your whatever, your rent, your car, your groceries, all that. Then whatever's left over, you dedicated 80% of that towards your loans.
That's right.
Got it. Got it. Okay, I just wanted to be clear over here. Okay, so and then how long approximately did it take you to kill those loans?
I'd say for me, I was pretty lucky. I had some good associateships in my first couple of years, so pretty much took me maybe about a year and a half, 2 years.
And
But everyone's different. Everyone
yeah,
carries a little bit different debt load coming out of school, and so that shouldn't be. Everyone's going to be different with that.
everyone's going to be different, but what was your number? Was it 150, 200, 250?
My number was around 150,
150.
100
Okay.
to 150. Yeah.
Perfect. Perfect. Okay. Great. Great. Okay. Sure. So, what type of lifestyle were you pretty conservative in that first couple of years?
Coming out of dental school, you're pretty excited to be done, and it's definitely mouth-watering to finally be able to earn some income. And after being a student for so long, that's it's definitely something that, has to be managed. For my lifestyle, I definitely didn't shy away from taking courses. I would encourage, that still in the first year, even with, a debt load, because setting up a foundation for success in your career, it can't be understated how important it is in those first few years. And part of what I'm going to be talking about today is setting that foundation and that scaffold for a future career trajectory that is going to be suitable for that particular person. So for me, I wanted to set the foundation very strongly and embed that foundation very strongly in my first few years. And that's kind of about leading into, my 5-year plan. But I did a lot of courses in my first year. That took me to a lot of different places because you have to pay to see the people that are good. But I was conservative when it came down to saving money and that kind of thing too. So it's all about a balance, and you're going to be excited to be making money, but don't spend it faster than you earn it. That's for sure.
Yeah, yeah. And so what were some of the key things in that 5-year plan that you'd like to share?
Well, the whole concept of a 5-year plan, I think, is really foreign to dental students. If no one gets anything out of this seminar, I think the most important thing actually about it all is really the 5-year plan. What is a 5-year plan? A 5-year plan is a scaffold. It is a house with just wood planks on it that is a foundation. It is a structure. It is a scaffold for which you understand how life is going to hit you and how it's going to approach you. So what I mean by that is, just say, you have your structure, you have your scaffold, you have your 5-year plan, and, life throws you a curveball. Your associateship, the clinic shuts down or something like that, and you're wondering, what's the next step? If you have a good 5-year plan set up and as a foundation for which you're going to grow, making decisions when those problems come up is a lot easier, and you have to do a lot less soul searching to have an understanding of where to go. And I think that's really important because I find that a lot of dental students and a lot of new grads have that tragic flaw where they literally are working day to day. They're working week to week, paycheck to paycheck, and that's really what's kind of driving them in terms of time. But they don't have a good plan on where they are from time zero to time, year 5 or something like that. And that is a big problem because you end up, one, maybe working in associateship too long, or you end up working in a job that's not a good fit for too long. You end up working from paycheck to paycheck, so you don't have a vision on where you're planning to go. And this is kind of what I'm talking about as well with career trajectory. Career trajectory is like a graph. And do you want your graph to be flatline, or do you want your graph to be, moving forward and creeping up the y-axis? For me, my trajectory where I had it planned in my 5-year plan, everything has, has coincided with my 5-year plan pretty well. It's never going to be perfect, but I can't stress the 5-year plan enough to help set you up for potential issues or things that could happen in the course of your career.
Sure. How many, from where you are now to when you first started, how many different associateships did you have?
Um, 3.
3.
Yeah,
Okay,
yeah,
perfect. And then you
3.
stayed in the first one for how long? The second one for how long? And
Yeah, this is also a good question too. Um, what this kind of gets into, I think, some things later, but uh, what do you want to look for in your first associateship? My first associateship I worked at for 2 or 2.5 years almost. So, it was a very successful job. It was successful and long term because I took the time to invest in understanding and looking at the key parameters that everyone needs to do in looking for the first job. So I'll talk a little bit about that, but I've seen too much with dental students coming out of school that they hop around too much. They're not looking for the fit. They're looking for a job. And when you're looking for a job, you're going to find a job. But when you're looking for fit, you're looking for some completely different set of parameters. So finding a job is easy, but finding a good fit is not. So what can you do to find a associate job in your first year that's going to be a good fit? Um, these are some things to avoid and are questions that are stupid and don't provide any value. One, oh, what kind of endo system do you have? What kind of instruments will I be using? Or are there electric hand pieces or, air hand pieces? Uh, you know, um, what are hours like? Will I be working weekends? No, these questions are not, these are secondary questions, maybe even tertiary questions. These aren't very valuable questions to be asking your principals on whether it's going to be a good fit for you. And unfortunately, because dental students aren't equipped to ask the right questions, they're asking these things and they end up going into these jobs and they end up leaving very shortly after. And I've seen it literally, I think in my graduating class, maybe 80%, 90% maybe, probably changed an associateship within, I would say, 6 to 12 months.
I saw the
Um,
same thing with my clients. Very, very common.
yeah, yeah, very common. And in my opinion, my career trajectory, I didn't want that. I didn't want to be hopping around associateships and compromising on the equity that I was building in that practice and compromising on the momentum that you grow by working in a clinic. Because when you start a new clinic, it takes time to ramp up again. And I don't care about how busy that clinic is. It takes time to build it up a little bit. So you start over if you keep on jumping around. So my opinion is to get the right one from the get-go. And it's never going to be perfect, but some key questions and things that I will mention now that are really important, key parameters and key metrics that you should ask is one, how many new patients am I going to be getting coming up in my practice? What is a healthy number? Is one healthy? Is 100 healthy? Like dental students, they don't know. What I consider a reasonably healthy ratio of new patients that you should be getting in as an associate in per month is about 10 to 15. Your speed is going to be slower when you come out. 10 to 15 new patients a month, I think that's healthy for you to support a practice. Another key question, are you going to be inheriting a patient base? So are you going to be starting with just those 10 to 15 new patients per month? Or are you going to be having some work from the get-go that you're acquiring? The third thing, is there an associate that you're replacing? That's really important because what you need to do is get in touch with that associate. You want to talk to them. There's no better person to figure out what that experience was like than the previous associate. And I've done research where that conversation alone saved me a lot of headache and a lot of grief. I had a position that was very rural where the income was good and all the numbers were good and the principal was saying a lot of the right things. And I talked with the previous associate, and what he said was completely different than what the principal did. So you'll be surprised by those things. If you do those three things, I mean, there's a lot of other things too. You'll be well ahead of the game, I think.
No, I think that is really, really good advice. I give some of that advice to my own clients saying, talk to the associate. There's a big difference between if you're a new hire to handle overflow because the guy's getting too busy, or if you're replacing someone. Usually what I find is that you have more stable income if you're replacing someone. And then, of course, you have the opportunity to talk to them. So I'm just going to transition to your experience practicing rural. I think a lot of people are on this webinar for that specifically. They want to talk about your experience, but I know just your background really quickly. You come from a rural environment. You're not from downtown Vancouver or anything like that. So a lot of people want to know, and I think a lot of people who are from Vancouver want to know, should I be seriously looking outside of BC to practice? And they wanted to know your experience, your challenges, your advice to them, and at the end of the day, the difference in income. So if you could just address that.
Sure. So, all these questions seem really daunting. When you're thinking about it, oh my gosh, should I move Vancouver? I mean, I've lived here for so long. Is it right for me? These questions are made a lot easier when you think of it and take a step back and assess your 5-year plan. And this kind of goes back to the previous slide. Everything comes back to the 5-year plan. So is your 5-year plan in 5 years to, be more clinically proficient? Is it ownership? Is it having experience in implants or ortho or this and that? Or is it just to be accomplished and feel successful in just the basics with, restorative surgery, endo? I consider those basics. And everyone's different. Everyone's career trajectory within their 5-year plan is going to be different. Everyone has set different goals for themselves, and no 5-year plan is better than anyone else's. It depends on the person. But practicing rural will be a good option for people who have a 5-year plan where they want to set a career trajectory that's maybe it's more ascending, maybe a career trajectory where you're a little bit more gung-ho about where you want to be in 5 years. Practicing rural will give you a great foundation for clinical practice for which your whole career will blossom. If some people are more comfortable living in a place where they're comfortable, like maybe Vancouver, if that's where it is, and just and building their career slowly, so they maybe don't have as high ascending of a curve on their 5-year plan. But if your career trajectory is something that's very ascending and it's a high slope, how are you planning to get there? And this is what goes back to my 5-year plan: is how are you planning to get that ascending slope? Are you going to get there by seeing 2 patients a month? No, of course not. It's very difficult to do that. If you're going to be seeing a lot more patients per month, and seeing a lot more volume, you're going to have a better chance of hitting that career trajectory that you want. So practicing rural fits within that. If your career trajectory is really high, like I want to be here in 5 years, I want to have mastered basic restorative, basic surgical extractions and basic endo, and I want to be getting into more complicated stuff like wisdom teeth or implants or ortho or whatever. You should think or consider implementing rural as part of your 5-year plan. So that's a preface to kind of maybe some of the specific things you asked there, Christian, but
Yeah.
practicing rural can be a good option.
And then what about for people who basically don't come from a rural place? What would you sort of say are the challenges that they should know about, from your experience?
Well, I think whenever you're moving, there's always challenges, right? So whether those challenges are related to being in a rural place or not, I think sometimes is misguided. I think some people who just get homesick, regardless of where they are, will sometimes equate that to it being rural, but that's not necessarily true all the time, I don't think. I think some of it is, the adjustment of working. When you first start working, you're going to be exhausted. I mean, putting in an 8-hour day or a 6-hour day or whatever, at the end of it, you're going to go home and you're going to be like, wow, white. And that happens for every new grad. So, don't be surprised by that. But you're going to be wiped regardless of, where you're at, whether that's Vancouver or whether that's rural, right? So, um, what you do within, your spare time that's an important factor. Who your network is. Um, some people are maybe a little less outgoing. So being in a rural setting is a little bit more isolating for them, right? And that can be a problem. You have to know yourself as well. Um, in rural, obviously some people will move for the position, and that's fine because if it fits in your 5-year plan, your career trajectory to be rural, um, then and rural is a good fit for that. Then make that fit. But there has to always be a balance too, and um, what you do with your time outside of rural is outside your clinic time is important too. So keeping a balanced lifestyle, that's important.
Yeah, I sort of have always talked to clients who went rural, and I said, one thing that I always recommend is to first of all, if you've got a partner, is the partner on board? Because is it we're going to have a long distance relationship, or that partner is coming with you? And I sort of find that it's really daunting on the relationship, and it's daunting on the job when they're sort of kicking and screaming, coming along, especially if it's for extended period of time. So I think having the relationship, I sort of find it is the first step to see if it fits with what you guys are doing. The other thing I do is on the lifestyle side. There's rural, like 5 hours away from any city, and then there's rural. I'm 45 minutes away from a city, a bit more of a suburb. I find if you're kind of not used to rural, you want to be within a 2-hour driving distance from like a city like Calgary or Edmonton or something like that, just because you've got your weekends where you could do some things. Usually you go to work and you come home and you're bagged, but if on the weekend you have the opportunity to still go out, there doesn't seem to be that same need over here to of that homesickness, I find.
Mhm. Yeah.
Yeah, you're a dental owner now. I think a lot of people are curious about how that transition occurred, how you did it, how you figured out it was the right time, and even to say, did your salary change, or was it just you had the same salary except a lot more responsibilities now? So let us know.
Sure. Yeah, Christian, I think that you're spot on with your little Venn diagram here on the bottom left, and I'm sure
Yeah,
you'll transition into that
sure.
once I kind of chat here. But um, in terms of being an owner, that was in my 5-year plan. I wanted to be a dental owner within 5 years, and you have to be really careful about your motivations on being an owner. Some people aren't equipped for the headache. Some people, because there is a lot. Okay, it's a whole set of new, different types of problems than just clinical dentistry. So, one, I think everyone needs to have some sort of clinical proficiency, just a clinical foundation of, a certain standard before they become an owner. And that was one thing that I thought was very important. I wanted to have a good foundation in clinical dentistry before I became an owner. Um, just about me and my background, I do have a graduate level master's degree in business. So when I talk to people who might not necessarily have that, what are some things that I can tell them in basically those years of schooling that distills down to make sense for dental students? And um, I would say that is an important first step is making sure you have a good grasp of clinical dentistry first before becoming an owner. The second thing is, really looking yourself in the mirror and seeing if you actually got what it takes. Because it's a different set of challenges, and you need to make sure that you're preparing yourself adequately enough to be able to um, provide some sort of structure as an owner. So doing continuing education, I heard breakaway seminars are pretty good. You guys can look that up as a CE, a business practice management thing that you can look into. Um, and And the other thing about being an owner is whether really it's something you want. Is it something you want, or is it something that you feel is successful? And um, that's something you really got to look into, because as an owner, for the most part, and this goes into the salary change, you will pretty much be making a similar amount as an owner for the first little bit while you're paying off your practice loan. What I see now um, for valuations for practices, where it's sometimes 100% um, of revenues, pretty much for the most part, if a bank is financing 100% of your loan for you, um, to service that loan, most of the proceeds, additional proceeds that you would get from being an owner, are being directed primarily to paying off debt payment for the practice, right? But the key difference here is that if your salary isn't changing much, and you might be thinking, well, then why change? Well, you're actually building an asset at that point. You're actually building equity, and you're building on that momentum, and so there's something to be said about that. And you also got to plan into how long is it going to take to pay off that loan, and every practice is different, right? I mean, it might take 10 years, it might take 5 years. So, it depends on what type of sacrifice you're willing to make, and the type of fit that the practice is, but that's a whole different conversation.
Yeah, no, I agree. I agree. And that's usually what I hear, 5 to 7 years to pay it off. You're either paying off the bank, you're paying off the principal dentist. He's sort of acting as the bank over here. And then, I guess you got to work with a good accountant in order to value it. But I think that's some really good advice over here. But it's going to transition me into a question here. For young dentists, what do you think is the best CE credits that they should be taking? And one person asked, is it ones to strengthen their skills that they already have, or is it other ones to strengthen new skills? And if they're thinking of becoming a dental owner, what are some that you might recommend?
Well, in terms of a clinical perspective, I think doing CE for new skills is more imperative. One thing that I do want to tell you guys is that despite all the headaches and annoyances and about UBC dentistry, we do get a pretty good education. And trust me, it pains me to even say that sometimes because of all the headaches that happen. But I've traveled a lot for CE. I've done externships in the States. I've worked in hospitals for surgery. I've talked to a lot of different people from, all across North America. And the quality of education in UBC dentistry is great. You will have a great foundation for which to build upon for your clinical practice. So that is good. So with that said, I think it's better to nurture new skills coming out of school. So I think a really common one is doing CE for endo. I think one course that's has had a lot of positive reviews is Mark Olison's course. He doesn't really preach any one particular system. He just teaches you just good basics. So I would probably recommend that in terms of a clinical perspective. In terms of a business side perspective, like I said earlier, the breakaway seminars I've heard are pretty good. Like I said, I haven't taken any of them because I do have that background in business that's really given me a very strong foundation. But I've had people in similar situations to myself take those, and it's been good.
No, that's fantastic. I wanted to take a look over here at some other in terms of the right time well, people always ask about salary change, and so I'll quickly go over my Venn diagram here. Usually I say to my clients is that if you're going to make a change, whether it be the associate or as a dental owner, there are really three things that need to intersect. One is your skill set at that time. If you're going to become a dental owner, do you have the skill set to actually be a dental owner? Have you done any preparations, or do you have any background? The second one is the interest. Are you going to be a dental owner for all of the right reasons as opposed to an associate? And is your interest going to be there? Are you excited to manage people? Are you excited to, handle the problems? Are you excited to have to make decisions on leasing the building versus, owning the building? And the last one is the compensation. Whether even if the compensation isn't there to begin with, does it fit in that plan of yours? Because I find that people often will do it they'll get two of the things right and then that third one wrong, and then they sort of realize, why am I doing this over here? So for my clients out there, if you are going to make this right decision over here, it's got to take the three into account. It's got to be the salary, the interest, and the skill set. And then if you're not at that point, I would say delay doing it, because anyone that says, like, you obviously love being a dental owner, and I have other clients who own their practices and they love it. And then I have other ones who it kind of is like the thorn in their side. It's like they're always complaining about it because they're complaining about staff or they're complaining about the issues. But guess what? That's what comes with being a dental owner. All of that comes with it. If you don't like dealing with, staffing issues, don't be a dental owner. I think staff is one of the most complex parts about being an owner.
Yes, no, I totally agree.
Yeah.
I agree with that Venn diagram wholeheartedly. And for me, what's a good question about well, about staff or about being an owner, about whether looking yourself in the mirror to see if that's really something you're interested in? For me, to be an owner is basically being a manager. And I one of the greatest, I would say, one of the greatest things that one of my staff had to say lately was um, they said, I just love coming to work. I was in a job and I was stuck in a job where waking up was a chore. And now I feel like coming to work has been, a kind of new shot at life for me. And I really appreciate what you've done to set up the culture here to make it that way. That is like that's like doing like an awesome endo and seeing that little puff at the end, or
Yeah.
doing that awesome implant, and you're just like, wow, that's perfect. The bone level is awesome. That for me is my ecstasy.
Yeah.
So if it's not, then maybe delay that decision.
Sure, sure. Okay, so what I want to do now is I do have several questions here, and I think let's just rattle them off one at a time, because there are some questions here. Some of them are pretty random, but here we go. Okay, so one person asks, can you locum as a dentist the way that physicians do? Like just come in and replace someone for a little bit?
Yes, you definitely can locum. You have to look for the opportunities, basically, which is never going to be stable. And there isn't a high degree of predictability about it because you're not really sure what that position is going to be like. But for the most part, a locum will usually be pretty good because the usually the dentist is stuck in a position where they have no other options but to ask someone to help them. So they're probably going to have a decent situation for you where you'll be reasonably busy in those times. Otherwise, no one would ever do it. So I think locuming is possible. Um, and but it depends on the situation, and it's
Sure.
kind of unpredictable.
Yeah, no problem, no problem. Okay, this question is addressing you as a dental owner. Someone is asking, is it worth it to invest in a CEREC machine?
Uh, so the basic bottom line is how many Seracs or how many crowns or units of crown or bridges should you be doing on a Serac per month to make it worth it for to buy that machine? And bottom line is you need to be doing 20 to 25 units
Got it.
at least. Okay, write that down if you're
I got
interested
it.
in it.
Yeah, got it.
Yeah.
Okay. No, that's great. That's great because I do have a client who's sort of transitioning into a practice, which I believe he's going to buy fairly soon after he graduates. It's sort of being teed up for that, and that was a question he had. You personally, when did you incorporate your practice?
So incorporation, it has to go hand in hand with your accountant, but basically, um, when the debt reduction for your loan has started to uh, when the debt reduction for your loan has started to be eliminated and you're starting to acquire more money than you need, that's basically when incorporation is a good time. Everyone asks, when do I incorporate? Well, they're like, is it at 1 year? Is it at 2 years? Is that like dental students always want a cheat sheet, right? That's just the
Yeah.
way it is. But
Yeah.
it's not a life is not a cheat sheet. Every situation is totally different. But bottom line, my cheat sheet for you is when you start acquiring more money than you need, and all that money's not going towards debt reduction anymore, that's when you should consider incorporating and talking to your accountant.
Yeah, yeah, I agree. I agree. The loans have to be pretty much in control or almost gone, and income has got to be at a level where you don't need all of it. Because if you're pulling all of it out and you need every single penny of it, it doesn't make sense to incorporate. Yeah, and
That's
then
right.
I think for some people do it as early as year two, and then some people it might be in year 4 or 5, but that's just a general range that what I've seen.
What One more thing I wanted to add about this, and this is a common misconception, is a lot of students think, hey, if I don't incorporate, I can't write off my business expenses. No, that's not true at all. When you graduate, you're a sole proprietor, which means that you own and operate a self-employed business. So anything pertaining to the business, going to CE, traveling to wherever to take that course, those are business expenses as a sole proprietor. So you don't need to be incorporated to write off your business expenses. So if you're doing incorporation just to do that, that's foolish. Because there are expenses associated with incorporating. I would say per year, probably it depends as well. But I mean, in terms of accounting costs and maintaining it and legal fees, you're probably in the range of 2 to 4K a year to maintain a corporation.
Yeah, yeah, no, I agree. I agree. Okay, and then this is a question. I don't know how well you could address this. You might do it in percentages, but what have you seen? Because you've been in BC, you kind of understand BC. You're from Alberta, and you now own a practice in Saskatchewan. People want to know kind of what are the income differences? Is Alberta 20% more than BC? Like just as a paintbrush, just as a broad stroke, and then how does Saskatchewan compare?
Um, well, let's start with BC and Alberta because those are kind of reasonably similar. I would say, I mean, it's very, very difficult to paint it in broad strokes, right? Because if you're working rural BC, you might be getting paid just as much as maybe working,
Yeah, yeah.
in rural Alberta, right?
Great point. Great
So
point.
it just totally depends. But generally, broad strokes, I'd say in Alberta, because of the business environment here, you're going to be getting, it's probably about 20 to 25% more in Alberta than you would in BC. I just that's totally general,
Yeah,
totally depends on
no,
the
I agree.
situation. But
I
yeah.
agree. And Saskatchewan?
Well, Saskatchewan. Now that is where things get interesting because Saskatchewan is, you know, no, uh, no other way to put it really is a gold mine. It is the golden ages of dentistry. Okay, BC and Alberta at this point are rich, really enamored in just legislative and just political challenges and problems. Saskatchewan is like the wild wild west. Okay, there's the type of demand that's there is it's like practicing 30 years ago. So open it and they'll come. So if you're looking for something like that, it's like it's totally different. So if you are someone who wants that super diverse and expansive and thorough type of dental experience, Saskatchewan is definitely a good option. And in terms of what you'll get paid, uh, if you have a reasonable control over um, how you're doing things clinically and you're treatment planning well, the numbers are really good in Saskatchewan.
No, that's fantastic. And I know if anyone was interested in Saskatchewan, whether you're looking for someone or maybe you know another clinic, I'm going to invite my clients to connect with me. And you've always been so generous with your time whenever I pair you up with someone to chat with as well. So, if any of my clients are, serious about looking at these areas over here, I know you've offered to give people advice over email or maybe a phone call.
Certainly, of course, Christian. Yeah.
Yeah, no, that's fantastic. Another sort of a question was, in your third year, did you do anything over the summer as an internship or that UBC program that helps to pair you off in third year?
I did, yeah. They called it the SSPP program,
Yes,
well, at
yes.
least when I went.
I think they still
And
do.
yeah, that was one of the best things I've ever done. It was just a great summer. I was living in Castlegar, which is kind of in the Kootenays area, and it was incredible. You got a little taste of what, clinical dentistry can really be, and it gives you that shot of life again. It just motivates you to, get finished and get out of school, and it gives you a really bright light at the end of the tunnel to make you realize that, hey, it's all going to be worth it. The one asterisk that I have to say with all of this is that when most people come back from their SSPP programs, they have a little bit of depression coming back into school. So you got to make sure you prepare yourself for that, because you almost take 10 steps forward going into working in clinical practice, and then you take 12 steps backwards. You feel when you go back into school in fourth year. So make sure you don't come out guns a blazing. uh
Yeah,
I
yeah.
know that's definitely what a lot of people have done, and
No,
that can be trouble.
yeah, I could definitely see that because you're getting all that practical experience. There's a bit of a, oh, I think I know everything, and then you're going back and you're suddenly having to write tests and things. And no, I could definitely see that. But, where I kind of want to transition this because I know I want to be respectful of people's time, but it'd be great to have another conversation another time regarding investments in business. But I do know, Mike, because we've known each other for several years now, that your philosophy is along my philosophy, and that is that money, sort of the way we build our financial wealth, really should be based off of three different realms, and that is, our personal business, being dental owner. How much do you invest of your time and your energy into business? And that could be your own personal business. It could be the stock market. How much do we invest in real estate? And you're just like me. You're a real estate guy. I know you're a little bit more on the commercial side. And I like the multi-unit, but of course I also like residential. We both have our opinions about residential. And then the other one is reserve. How much should we save inside sort of cash and fixed income or insurance? And so, at Latitude West, we have that philosophy of what is the correct allocations. And if we get it right, we can accelerate our wealth. And our last, for my clients, I did the Accelerating Wealth series, and I plan to do several of these workshops throughout the year. If everything goes well, I should be able to do at least 4 to 5 of these. We're on our second one on April 7th, Accelerating Wealth Workshop Series number 2. Most of the people that signed up for the first one are continuing on to the second one, but a few people who missed that one really should be attending if they're my client. If you're not my client, and if I've got any spots, we do have a guest registry. You could email it info@latitude-west.ca for a guest spot. And this, unfortunately, is only geared towards physician and dental clients because I'm using their income bracket when I talk about how to reduce taxes using items like real estate or investing in your business. So if for those of you who can make that, I like using Robert Kiyosaki's model of Rich Dad, Poor Dad because he's a big real estate guy, much like myself over here. So if you are able to sign up for the Accelerating Wealth series and you're a client of mine, you really need to be in that room. Talk to some of your classmates who were in there before, and they'll tell you that they really, really did learn a lot. It's 2.5 hours on Broadway and Birch at my new office over here. And for anyone who is still not my client yet, but would like some better advice than what they're getting now, or sort of like my approach to education as well as likes my approach to investments, always feel free to give me a call and reach out. We'll set up a time to talk. And I want to continue to educate everyone as much as possible, get to know people, just to see as well if there's a fit between my practice and what you're looking for. But it looks like, Mike, I'm just at about our ending time over here. I want to thank you again for the time that you've given us. I want to thank you again for all of the great information. And to my clients over here, I invite you, if you have more questions, you can absolutely connect with me, and I can ask these questions on behalf of Dr. Mike Ma, or we could continue to work together to figure out that right fit when you guys are transitioning into your role. But Mike, thank you again.